Welcome to Duke Spine Institute. We're streaming live. We're going to start with thoracic, Duke laser disc repair. Patient coming from Canada with 20 years of back pain in his thoracic spine, 2 herniated disc with annular tear, disc bulge, T7-T8, T8-9. We're going to start by localizing. All right, that's 12, right? 12 shot. 12, and I'm going to go up. Let's see. Don't move the fluoro. 11, 10, 9, shot. Shot. So that should be the pedicle of 9. You agree? 12, 11, 10, 9. Yes. Stay there. I'm going to go up one more. Should be 8. 8. And then the next disc up will be 7, 8. You agree?
Yes, sir.
Shot. That's 7, 8 right there. So 12, 11, 10, 9, 8, 7. We're doing 7, 8, 8, 9. Everyone agrees? All right, so we need to stay there, Jordan. Keep an eye on which disc that is. It's got that little notch in the middle. You see the notch? All right, so don't move anything. Let's get started. We're going to put some num-num. We're on the right side. Yeah, my mark, if that misled you, is just a pre-op mark. All right. Little numbing. If you have questions, feel free to ask us during the surgery. We're going to repair 2 thoracic disc herniations. One is the T7-T8, the other is the T8-T9. Again, this patient suffered with pain for many, many years, and he's from Canada. Unfortunately, a system that really doesn't, in my opinion, doesn't help people with non-emergency care. That's the correct disc, we all agree? All right, 2 medial, so it'll come lateral. Shot. All right, let's go lateral view. At least we have the disc right, 7, 8. We're going to do this one and the one below. Welcome to Duke Spine Institute's live stream. We live stream all of our surgeries from beginning to end so you can watch and ask questions. We don't hide anything. Yeah, so those cables are in the way, guys. All right, shot. Looks good. That looks good. I'm going to probably angle a little bit more steep. And I may want to come a little bit more lateral. Shot. It's fine. Shot. All right, so I'm lined up with the disc nicely. Let's go back to a AP view. I think I'm hitting his facet. Shot. All right, we're at the right disc. Let's go back to a lateral view. By the way, for those of you wondering why we're concerned, the thoracic spine is the hardest part of your spine to localize to the right level. The reason is because there is so many discs and they all look pretty much the same, so you have to count ribs, and that's the only way to really know. Shot. All right, we're slipping past the facet heading towards the disc. I've got to just get past this facet joint. Shot. You guys see the needle is heading right to the back of the disc. That's
yes,
what we
do.
Want. Shot. Very close. Shot. I think we're still a little bit medial. Shot. All right, give me an AP. Seems like we're just a little overexposed, but I can still see the disc pretty well. Shot. All right, that's good. That's very good. Lateral view. I'm probably going to change my entry point slightly. but I want to get back into the lateral view first. All right, now keep an eye there. So we got the marker at the vertebral body above. So I am going to come from a little bit more lateral position. Shot. Shot. Everything good, Dr. B?
Yeah.
What's wrong? No, you keep him asleep. Yeah, he's giving us a little trouble with the shot anesthetic in terms of not responding the way we want him to. He's difficult, right? To get sleep? To stay asleep? He's okay now. Vital signs are good, but we don't want to wake him up. Shot? All right, let's see where we are. Good lung fields. So we're too medial. No? Shot. Shot. Okay, we're just at the back of the disc now. AP. This is the first disc we're fixing. It's the T7-T8. Everyone agrees? You can see the 12th rib at the bottom of the screen there, Henry. And then you count up, it's 7-8. You can see the disc is definitely damaged. Shot. All right. If I can just get into this disc, we'll be golden. Shot. Shot. You think we're lined up there on the end plates? Probably, right? Mm-hmm. Shot. We're just at the back of that disc. I actually feel like there's some calcium here from chronic inflammation. Give me an AP. All right, looking good. We're just hitting against the top of that end plate of 8, 12, 11, 10, 9, 8, 7. Yeah, so the lateral is not a true lateral. We're not seeing that top end plate. That's the reason. We're hitting that end plate. Shot. That looks pretty good there. We should be in the disc. I feel it just wiggling in just a little bit. Normally it would slide nice and easy, but I think this disc has been damaged for so long. Doing good? AP. Let's make sure we're not being deflected laterally. If we are, I'm going to have to try a different strategy. No, that looks pretty good actually. I'm pretty happy with that. We're going to do a little test, stay there, a little test injection just to make sure. This is a discogram. It helps us see the contour of the disc from the inside. Yeah, it's right on the end plate, John. All right, I think I got it. All right, that is not going in the disc. Let's see. Come back to a lateral. And if it is, it's being ejected out. So some discs are so inflamed and damaged they have a lot of scar tissue. It pushes the dye out. I want to make sure, see if we're dealing with that situation. Shot? Yeah, it looks like it's going into the disc, but it's coming out through the tear in the back. So I think we're okay. I'm going to place the second needle. Everything good? Stable? Yes. Shot? All right, we're going for the T8-9 disc. Shot? Everyone agree 8-9 is next? Shot? This patient has suffered with pain for many, many years. And our goal today is to get rid of that pain. Give me an AP. Yeah. All right. So already medial. Shot. Shot. A lot of times we can treat both discs with the same incision, but not in this case. Shot. 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 AP. Again, we're right at the disc, Coker. I want to check two planes, front, back, side to side. Gives me a three-dimensional assessment of where we are. Perfect. Lateral. You can see the dye in the disc above from that injection, but it is full of scar tissue. Very common problem when people have herniated discs for many, many years. They get dye, they get scar tissue in the disc. All right, we're in. So we're in the two discs, 7, 8, 8, 9. I'm going to do another discogram shot. This one doesn't feel like, there it is, perfect. This one doesn't have as much scar tissue, so I feel the dye going in easier. All right, but still, I feel the scar tissue as well. AP. Lateral. That's perfect. Lateral. We're going to use the cervical, the small scope. Shot. All right, guide wires in, shot. There it is. So we're going to make an incision, 4 millimeters. So people may be asking, why is he operating on these two discs? The answer is they're causing him pain. And from the best of our tests and experience, this pain, it never goes away when it's coming from a disc. It just gets worse, gets better for a little while, then gets worse. And over the lifetime of the patient, the pain gets worse, it gets more severe, it gets more constant, it stops going away, and it's just there every day, and it interferes with life. And people end up treating this pain with drugs or alcohol or other things that are even worse. And nothing works to get rid of this pain. Nothing. Nothing in the world except for this one surgery you're watching. This surgery, I pioneered it. It's called the Duke Laser Disc Repair. We've published it. It's FDA approved. So all the equipment, supplies we use is approved by our government for use in treating patients' medical problems. It's also been, hold on, peer-reviewed and published. As a matter of fact, I published the Thoracic Duke Laser Disc Repair years ago. I presented it in a scientific meeting to spine surgeons in Los Angeles. And it was very well received. It was considered one of the best papers at the entire meeting. But it's not a surgery just anybody can do. You have to be trained to do this. Henry.
Yes, sir.
Let's show the audience the 30 causes of back pain. And when you watch this video and you start to understand that there's about 30 different causes of pain in the lower back, and we don't have a video specific to the thoracic spine, but the thoracic spine is just like the lower back in that the disc and the facet joints are the two most common cause of chronic pain. Of course, you can have a fracture as well. Some patients have bone fractures that cause pain. They're called osteoporotic compression fractures. But long story short, the most common cause of pain in the thoracic spine, called dorsalgia, is a inflamed annular tear, which is in the back of a disc. I'm Dr. R. Duke Majan with the Duke Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Duke laser disc repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L4-5, followed by L5-S1, then L3-4. The L1-2 and L2-3 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L1-2, L2-3, L3-4, L4-5, and L5-S1. The most common facet joints to cause chronic back pain are L4-5, followed by L5-S1, followed by L3-4, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Duke plasma rhizotomy of the SI joints offered at Duke Spine or Duke Joint Institute. The fourth most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Duke piriformis muscle release. This is performed percutaneously with a 4mm incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic pain down their legs, with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for permanent relief of piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine, touches the vertebral bodies. With trauma, can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with X-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4, and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the facet joint, causing 10% of the chronic back pain, followed by the piriformis muscle and sacroiliac joint, which cause 4% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable with the right treatment. Thank you. I'm Dr. Duke Majan. Thanks for joining us.
Caramel, she makes herself chocolate and walnuts and pecans.
All right, make sure some of that's left over. I gotta try. Welcome back. You can see from the video that the disc injuries are the most common cause of back pain, and that's what this patient has. He has 2 disc injuries in the thoracic. They've been there for 20 years. He's lived with this pain for 20 years in Canada. He came to the United States to Duke Spine Institute, the only place in the world that can cure that pain, and I am feeling really good about it. See the blue stuff? I've been zapping away at it. That is the herniation. So already I can tell you that this disc is definitely damaged, and it's got all the findings, the blue disc, the tear, the calcifications right here, the gold stuff, the scar tissue of chronic inflammation. That's what I want to see. When I see those things, I'm thinking this is going to work, and that makes me feel good about what we're doing. So look at the tear right there. You guys see the blue? The blue is the herniation stuck in the white tear. The white used to go across. It was a barrier. It's called the annulus fibrosus. It holds the blue stuff in, but when it tears, as it did for him when he was young, and the blue stuff leaks out into the tear, it creates bad inflammation. And that inflammation is where all the pain comes from. So I'm cleaning it. I'm the one who pioneered this technique 19 years ago, and we started doing the thoracics about 5 years ago. We've done almost 30 now, and of the 30 patients we've done, they've gotten 99% pain relief permanently, 99% on average. The patients that we studied, so it's an incredible procedure.
We have a couple of questions.
Mm-hmm.
These first 2 questions are coming from Lanu on YouTube.
Hi Lanu, welcome.
First question asking, is there a connection between back pain and neck pain?
Lanu, back pain does not cause neck pain. If that's what you're asking, and neck pain does not cause back pain. But the only connection is the causes. The most common cause of back pain, almost 90% of chronic back pain is from a disc injury. 90% of chronic neck pain is a disc injury. So that's the connection. They have a common causation of back and neck pain. The second most common cause of back pain is a facet joint inflammation from an injury to the facet joint. And that is also the second most common cause of neck pain. So the connection between back and neck pain is that their cause is the same. It's an injury to a disc. The difference is that they're anatomically far away from each other, and neck pain does not cause back pain and vice versa. Henry, let's show people how we deal with the thoracic disc herniation to get rid of the pain with the laser.
Of course.
Disc injuries are a common cause of chronic thoracic back pain. The inflamed annular tear causes thoracic back pain. A 1/4-inch size skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. The advantages with the Duke laser disc repair is that it's an outpatient procedure that takes 30 minutes to complete, very minimal bleeding and pain after the surgery with immediate recovery and return to work the next day, as well as a 99% success rate and permanent pain relief with a single treatment. For more details, please visit our website at www.dukespine.com or call us at 1-800-FIX-MY-BACK, 349-6922.
All right, welcome back. Henry, take us to our next video.
Of course.
Facet joint injury is a common cause of chronic thoracic back pain. The inflamed facet capsule tear generates pain signals. The best treatment for facet joint pain is the Duke plasma rhizotomy. Inflamed facet joint pain nerves are destroyed. The advantages with the Duke plasma rhizotomy is that it's an outpatient procedure that takes 30 minutes to complete, very minimal bleeding and pain after the surgery with immediate recovery and return to work the next day, as well as a 99% success rate and permanent pain relief with a single treatment. For more details, please visit our website at www.dukespine.com or call us at 1-800-FIX-MY-BACK, 349-6922.
All right, welcome back. We're almost done with the first disc, T7-T8. There's the end of the disc right there. The last of the herniation and granulation tissue. You can see we've gotten rid of the herniation that was stuck in the tear. A lot of scar tissue that was there I removed. I think he's going to do really good. This pain will be gone in this area. Tell us about the laser, Henry. Huh?
Water is ready.
Thank you. Let me just finish this.
Well, the laser.
How big is that laser fiber?
Oh, that is 1 millimeter.
Half a millimeter.
Half a millimeter,
Yeah,
excuse me.
The small scope is half, the big scope is 1. Where is the laser made?
Oh, you always tell me.
Israel.
Israel, yes.
This place you've probably heard of.
I've been to multiple times, 3 times.
Best laser in the world
Yeah.
for medicine. This laser. Unfortunately, they sold to Boston. And anyway. All right, we're done with one disc. We're going to move on to number 2. He has no allergies, right? Yeah, the sucker, the little thing. Is he doing good, Bern? All right, we're going to move on to the next one. Stapler, if you have it. I'll take that. Right. Any questions?
Yes, this next question coming from Lanu once more on YouTube asking, the patient is very young. How did he get back pain so early?
Great question, Lanu. All these back pain injuries come from injuries, trauma. He must have fallen or gotten into an accident. I don't know his exact story, but I know that it involves trauma. 100% of disc injuries are traumatic. When I talk to my patients, I ask them what happened. Many of them say, I don't know. I just turned wrong in bed and I had pain. That's not what caused the herniation. Turning wrong in bed never causes a herniation. Sean? Is that it? Sean? All right. Can you see the guide wire?
Yes, we can.
Sean? There it is. Good. Turning wrong in bed can cause a herniation, but can never cause a tear. You must have a tear first before you get a herniation. All herniations require annular tear first. No tear, no herniation. The tear requires a lot of force. Shot. Tears don't just happen. They don't happen from coughing and sneezing. They don't happen from minor exertional activities. They require tremendous force. Something must have happened. I believe, I don't remember his story, but he had some type of trauma to his, CrossFit. CrossFit? Yeah, it could be CrossFit. But I doubt it. I think CrossFit made it worse. CrossFit can make the herniation come out, but it can't make the tear. Unless he did something really, really, really weird with the CrossFit. All right. Hold on. Yeah, I think we're good. We're definitely in. All right, good. So we're fixing 2 thoracic discs, and then we're going to fix 1 lumbar disc and some facets. Sean? You can see the end of the tube?
Yes, we can.
Tube is entering the disc.
We have a couple more questions.
All right, I'll take them.
This next one coming from Faisal on Facebook saying, hi, doctor.
Hi, Faisal.
So what I recall from you is if you have a decompression surgery from a normal neurosurgeon, they can get that shooting down pain away when pinching the nerves. But they may have problems with eliminating pain as they can't do your surgery?
Yes, Faisal, what I'm saying is that every neurosurgeon out there does surgery for one reason. It's to unpinch nerves or spinal cord, okay? So it's either a peripheral nerve or a nerve root, spinal cord, some type of nerve. That's why they're neurosurgeons. But what neurosurgeons don't do is cure back pain and neck pain. So if you have weakness in your leg, numbness in your leg, tingling in your leg, and if you have weakness in your arm, numbness in your arm, tingling in your arm, from a pinched nerve in your back or your neck, they can usually unpinch it. That's called a decompression. But they do not cure pain. Their surgeries do not cure pain. They do not cure back pain. They do not cure neck pain. The surgeries neurosurgeons use are called decompressions. Whether it's a laminectomy, a discectomy, a microdiscectomy, an endoscopic discectomy, all surgeries by neurosurgeons and spine surgeons are for one purpose, to unpinch a nerve or a spinal cord. They do not cure pain with those surgeries. They unpinch nerves. Pinch nerves cause weakness, numbness, tingling, not pain. What causes pain is inflammation. And our treatment is the only treatment that eliminates pain. There is one more, it's called a fusion. If you do a fusion, that will also help eliminate pain. But all other surgeries done are not to eliminate pain, they're to unpinch nerves. Pinched nerves do not cause pain. They cause weakness, numbness, and tingling. They do not cause pain. Inflammation causes pain. And they are not treating inflammation with their surgeries. We are. That's the big mystery that I discovered. That's one of my greatest discoveries, is that I discovered pain comes from inflammation in the spine. And I found the source of the inflammation. It is the tear in the back of the disc. Nobody else has ever figured that out. So because I'm the first to discover it and other people ignore it, that's why we're the only ones treating it. It's very simple.
Next question coming from Steven on YouTube,
Yes, Stephen.
asking, can you describe his pain from what he said himself?
Yeah, his pain is in his thoracic spine, in the middle. He feels it deep inside his spine, and it's on both sides, left and right, but mostly on the right. And that's his pain. It's really not complicated. If you have pain in your thoracic spine, you need an MRI. Rule out a fracture, and if there's no fracture, tumor, or infection, then you probably have a disc problem. And if you have a disc problem, we can fix it. The world has for too long made too complicated the issue of pain. It's quite simple. Pain can be cured, depends on what causes it. You have to make a diagnosis. In his case, his pain here is coming from these two damaged discs. You can see all the scar tissue here. This is T8-9. Normal discs do not have scar tissue. Old discs do not have scar tissue. Young discs do not have scar tissue. Scar tissue only comes from one thing, inflammation. Inflammation is the cause of the pain. The scar tissue is a sign that the inflammation was here. If you find somebody dead on the side of the road at night and they have 2 punctures in their neck, you look at the puncture and you go, what does this? A vampire. All right. So this person must have been bitten by a vampire. When you see scar tissue, it's like seeing 2 punctures in the neck. There's only one explanation. It's inflammation. And this is scar tissue. It's that simple. Everyone tries to make pain so complicated. It's not complicated. You want to know what's causing your pain? Go to Duke Spine, do a free MRI review, you'll get a diagnosis. Once you have your diagnosis, you get your treatment. The treatment is directed exactly at the diagnosis. The problem is every other doctor out there cannot do that. They don't have no idea what the diagnosis is. They see the puncture holes in the neck and they say, I don't know what happened here. Maybe they got shot by a BB gun twice. Maybe they were bitten by 2 mosquitoes. Okay? There's only one answer. Everything else is made up nonsense. And I've been dealing with people's made up nonsense for years. And honestly, I have no patience for it anymore. I don't waste my time with nonsense. I get to the heart of the problem and we fix it. It's very easy to do. Anyone can do it, by the way. There's no magic here. They just have to know how to do it. And that's what I had to learn. How to do it.
We have another question
Yep.
coming from Faisal once more on Facebook.
Yeah, I want to say one thing. Look at how much scar tissue there is in this disc. This disc is by far the worst of the two because it's far more damaged from inflammation. The inflammation destroyed this disc. But the good news is we're going to cure the pain here and his pain will be gone. It doesn't matter how much inflammation he had, how much scar tissue he had, how little disc is left. It doesn't matter. All that matters is that we use the laser to debride the tear, called an annular debridement in the back of the disc. That's what I discovered and pioneered 19 years ago. And you do this and the pain goes away. It's so easy. You just have to be able to do spine surgery. Yes, we'll take the question.
Coming from Faisal. These next two questions are from Faisal once more on Facebook.
So Henry,
yes, sir.
Sorry to interrupt you, but we are going to be done with this in a minute.
Copy that.
And then we're going to end the stream, and we'll be back with our lumbar
Yes.
L45 Duke laser disc repair. Because this patient also, how's the irrigation, guys? Also has lumbar. It's not at the end. A lumbar disc herniation and lumbar pain. As a matter of fact, his lumbar pain is worse than his thoracic. But he wanted both fixed. Yes, I'll take the question.
Next question from Faisal. These next two questions from Faisal once more on Facebook. First asking, Doctor, why don't many surgeons operate on the thoracic spine? Are they a little afraid due to the fact that your organs are there?
Yeah, the thoracic spine is the most dangerous part of your body to operate on in the spine world. Okay? Of course, there's other areas that are dangerous, like the brain, right? But I'm talking about just the spine. So if you're a spine surgeon, the thoracic spine is one of the most complicated areas to operate on, if not the most complicated. It just depends on the pathology and the type of surgery you're doing. But yes, there's high risk because the spinal cord, because the spinal fluid, the dura, the nerve roots, the ribs are here, they block access. The bony anatomy blocks access. So you have to work your way around all those things, and that is not easy to do. You have to have the right instruments, the right training, the knowledge and experience, which literally I am the only one in the United States and probably the world. There's very few surgeons that do this type of surgery, probably at most 5 in the world. So that's because they're not trained to do it. They don't know how to get trained to do it. They don't know to do it. It is not a common problem. They don't see it every day in their practice. They don't feel compelled to learn because they don't see a need. Why learn something as difficult and complicated as this if you rarely ever treat it? That's their feeling.
Next question, Faisal, on once more on Facebook, asking, Doctor, if you have a weak immune system or autoimmune conditions, are you more likely to have these inflammatory back pain conditions?
No. The immunological system is completely separate from the inflammatory system. They have nothing to do with each other. The immune system is not involved, to my knowledge, in this process. The inflammatory system is. I don't think the immune system is involved. So having a weak immune system has nothing to do with disc pain, spine pain at all. It's 100% inflammatory. Look up immune system versus inflammatory system. You'll see the difference. The inflammatory system is much older and far less sophisticated. The immune system is far more sophisticated. It doesn't make these kinds of mistakes. All right, 1 minute. A lot of scar tissue here, but we're almost done. We're going to move on to the lumbar next. Any more questions?
Yes. We have one question coming from Brett on
Hi, Brett.
YouTube.
Sure.
Asking, could an annular tear be the result of weightlifting, in particular doing a leg squat?
Yes, you could tear your annulus squatting. You know, it would have to be very forceful. You can't just do a regular leg squat, lightweight, and tear. It's more likely to get a tear with like military press, clean and jerk, deadlift, those types of exercises, or hack squat. Those types of exercises are more likely to give you a tear than just a leg press with the bar on your back, unless you're lifting ridiculous weight, like 800 pounds. like some of these people do. It's typically traumatic. Football, soccer, gymnastics. I mean, that's typically who gets these kind of tears. Falling off your roof. If you want to know, go watch YouTube. There's a channel called Fail Army. Fail Army. And it's people doing silly things, jumping off things, and they're falling and hurting their spine. The pain may not come right away, but the tear happens then, and then the herniation happens later, and then the pain comes from the herniation. I'm having, how are we doing on irrigation? All right, we're pretty much done here. I'm very happy we were able to clean this thing out really good, and I think that's going to take away the pain. His body will heal the rest. Yeah, I don't see anything more. A little bone spur right there. Looking good. All right, we're done. We're outside of the disc. You can see, I'm just going to zap this inflammatory tissue here. But that's it, a little bit of bone spur at the end there. Bone spur doesn't cause pain, but it can pinch the nerve. So that's why I removed it. But that's it, we're done. We're going to end the stream. We're going to come back with the lumbar.